So today I'm excited to be here as we launch the video blog for Dr. Gail Rosseau, Chief of Surgery at the Neurologic and Orthopedic Hospital of Chicago. With your busy schedule as a neurosurgeon, why have you decided now to take the time to do this video blog?
Well, thank you for asking me to do it. I think we should be in the business of providing patients with information, and patients just want to know increasing amounts, as they should, about their condition and the condition of their loved ones. Their families who aren't with them at an office appointment might want to know about that as well. So first and foremost, to provide information. They also want to know more about health issues in general, so we'll talk about those things as well. So this is an efficient way of being able to provide some of that information that we're responsible to provide.
And I couldn't agree more. So Dr. Rosseau, let's start out this video blog by telling our viewers a little bit about your background.
Well, I'm from Chicago. I did my neurosurgical training in Washington, D.C., and where I think I had a great opportunity to be both well-trained but also to see the organization of healthcare delivery where it occurs in the marbled buildings of Washington. Then I went to Paris and Pittsburgh, both to do fellowships in complex skull-based surgery and learn how to do those procedures. And then I returned home to CINN in Chicago 17 years ago.
That's your professional life, so now tell us a little bit about your family.
Oh, I'd be happy to. Well, I've been married to my wonderful husband, Rick, the wind beneath my wings, for 25 years this year. He's an orthopedic surgeon and a very good athlete, former champion rower, so he's the one who makes sure that the two of us run the marathon every year. I have two wonderful children, Natalie and Brendan, who go to the public schools in our town. They are interested in history and in sports and in theater. And my parents live locally, so it's wonderful to have grandparents and children together at home. I have three sisters, one who lives here with her family, whom we see a lot, and two others who live out of state.
Speaking of your family, I know that you and your family are involved in a number of causes locally as well as beyond. Can you tell us a little bit about those activities?
Oh, I would like to. Well, as it turns out, when you're the mom and dad, but you're also a neurosurgeon and orthopedic surgeon, it really helps if your kids are interested in doing some of the same things that you're doing professionally. And we're very fortunate that our kids are interested. And in the course of traveling for meetings nationally through our American Association of Neurological Surgeons, the professional organization, or the World Federation of Neurosurgical Societies, our children have had the opportunity to travel with us and have learned a lot. But one of the things that they noticed in traveling primarily overseas is how often we see people who are injured with cranial head injuries and spine injuries who don't have the information or the technology to wear seat belts, wear helmets, and so they got on board. And so I'm very pleased that they're interested in peer-to-peer education. So they took a head and spine injury prevention program for children, translated into French, so we are able to take it to Africa and other French-speaking countries and help in that effort as well as nationally. So that's something that they've contributed to. They're also very involved in French, having gone to a French school. So there are a number of humanitarian missions we've done to other parts of the world that involve that as well. And finally, I think that travel has really focused efforts or attention on what can be done to improve and increase peace in the world. And so one of the things that our family has chosen and our kids are very involved in is service projects through interfaith efforts.
Great. So now kind of switching gears to talk about the blog itself again, what can we expect from this blog in the future?
Well, I think that we will focus, at least initially, on getting information out, real information about real neurosurgical problems, and help patients know a little bit more about what is available, what their options are, what is coming down the pike, so new technology. I think that'll be the first and most important initial thing that we do. But I think there'll also be time for reflections on public health issues, and I hope that we'll be able to be useful in thinking about those things, because I really do believe that although every doctor has an initial first specialty, the thing they were trained to do, that for all of us in medicine, our second specialty is public health. And so I'd like to be able to reflect on some of those windows into the efficiency or lack of efficiency of public health that working with patients every day provides me. And probably the most exciting thing about doing this as a blog is the fact that it's a means of two-way communication. So I'm looking forward to responding to questions or comments from our viewers and our fellow bloggers.
Well, I think that's great, and we're definitely looking forward to it with you. And I think sometimes we also look to what's happening in the news as to what we tend to cover each week as well.
Great, I'll look forward to that.